We will start by defining first what is tissue repair, and then we would move on to the various components of tissue repair, and finally we will discuss the processes by which tissue repair takes place, that is by regeneration and by laying down of the connective tissue and formation of a scar. Before we start with the topic of today, I think it would be easier if we would just recapitulate what we have done up till now. As you know, when there is injury to the body, what would happen? The body would respond. In order to combat the injurious agent and to contain the damage caused by that injurious agent, the body produces inflammation. This inflammatory process, depending on the duration, may be classified as acute if it's of short duration, and this acute inflammation is marked by the presence of polymorphonuclear neutrophils. Or if the duration of this inflammatory process is prolonged, then we call it as chronic inflammation. This chronic inflammation may again be, you have already studied that it may be specific or non-specific, but whatever, if the duration is prolonged, it is chronic inflammation. It is characterized mostly by the presence of macrophages and certain other inflammatory cells, lymphocytes, plasma cells, etc. But the most important thing regarding chronic inflammation is that the process of healing is also going on side by side, or rather this process of inflammation prepares the tissue, the damaged tissue, for healing. And what is why healing takes place? That is to restore the tissue to its normal architecture and function as much as possible. The healing process, as I've already told you, might take place by two mechanisms. One is regeneration and the other is repair by connective tissue and formation of a scar. We will study them in a while, but let me first clear that sometimes the two words healing and repair are used interchangeably, although by convention repair is used for parenchymal and connective tissue and the word healing is used for surface epithelia. But I believe that for all practical purposes, they may be used interchangeably. It doesn't matter what word you are saying. It should be. It's the process which has to be clear. Alright, so what is the difference between these two? The process of regeneration involves restoration to almost completely normal tissue architecture and function as it was in the previous state, whereas the scarring process just patches the area and sort of gives it a bit of stability, but the exact function and architecture is not restored. For the purpose of regeneration, we require uninjured cells which are able to proliferate and replace that replace the injured site, and also there is some help from the stem cells which provides certain cells and they mature and occupy that injured site. The process of repair by scar tissue involves regeneration as well as replacement by the connective tissue, that is scar formation, and both these processes have varying contributions to this repair tissue. So, to recapitulate, whenever there is tissue injury, there is loss of function and architecture. This tissue injury may be healed either by the process of regeneration or by repair with connective tissue. In cases of regeneration, the structure and the function are almost completely reestablished, whereas in the process of repair, the structure and the function are only partially re-established. The process of regeneration requires there are certain prerequisites for the purpose of regeneration. That is, certain conditions need to be fulfilled if regeneration has to take place. Now, what are those conditions? Those conditions is that, first of all, there should be some uninjured cells which are able to proliferate and replace the injured tissue. Then there should be a tissue framework present. Connective tissue framework should be there in order to align these proliferating uninjured cells. Then again, blood supply is very important. Otherwise, nutrients will become deficient, and obviously nutrients and energy is required for this process. Another feature that is required for the purpose of regeneration are the presence of stem cells. What are stem cells? Stem cells, as you may recall, are pluripotent cells which have the ability to mature into different directions. And these stem cells are basically of two types, the embryonic stem cells and the adult stem cells. Here we will be talking about the adult stem cells. So if any of these prerequisites are not there, then the process of regeneration complete restoration will not be there, and the tissue would be replaced, or the injury would be replaced and repaired by the process of scarring. Mostly, in most conditions, both processes are present. They contribute to a varying degree. In some cases, there is more regeneration, and in some cases, there is more of repair by connective tissue. Another feature which is important is that not just cell proliferation, but interaction between cells and extracellular matrix also has a certain contribution to this process. Before moving on, I would like to discuss two closely related terms. One is fibrosis. Fibrosis is the deposition of extensive collagen in the area of injury, you can say. So this injury may be due to as a consequence of chronic inflammation, as you may encounter in lung, liver, kidney, where if there is chronic inflammation, it may result in extensive collagen deposition, and this condition would be known as fibrosis. Fibrosis may also be seen in cases where there has been ischemic necrosis in permanent tissues. Permanent tissues I will discuss in a while. But whenever there is ischemic necrosis of permanent tissues, as in the myocardium, you can encounter fibrosis there. Another term is organization. Organization is the fibrosis which develops in tissue spaces where an inflammatory exudate is present. For example, in lungs, in cases of pneumonia, you know that there is exudate within the lungs, and this is a type of inflammatory exudate. And when it heals, it may heal with extensive collagen deposition, and then it will be known as organizing pneumonia. Let us now consider why these cells proliferate. What drives them? So the driving force here are the growth factors. What are growth factors? Do you recall? Yes, they are proteins which may be derived from various cells, mostly the macrophages, and their purpose is to push the cell into the cell cycle and make them replicate or divide. Now, in cases of this regeneration, a number of cells are proliferating. Like the injured tissue remnants, as I've already told you, then the vascular endothelial cells, which give rise to new vessels, which will be bringing in the blood supply, and the fibroblasts. The fibroblasts are required for the deposition of connective tissue, ultimately leading to the scar formation. While talking about the division of cells, as I told you, the cells may be divided into three categories depending on their intrinsic ability to divide. These are the labile, stable, and the permanent cells. The labile cells are those which keep on dividing continuously, and the examples are the cells of the lining of the GI, the skin cells. You know that this skin cells are shed off after every, say, 7 to 10 days, and they are replaced by new cells. And where do these new cells come from? They come from the proliferation of mature cells and also from tissue stem cells. These tissue stem cells, are present in small spaces which are known as niches within the close by. Alright, the examples of labile cells would be the hematopoietic stem cells in the bone marrow, the surface epithelia, especially the squamous epithelium of the skin, oral cavity, vagina, and cervix. Then the cuboidal epithelia lining the ducts of the exocrine glands of the liver, salivary glands, pancreas, and biliary tract are also labile. That is, they keep on dividing and being shedding, dividing, and replacing the shed of surface. Then the columnar lining epithelia, gastrointestinal tract, uterus, fallopian tubes, and the transitional epithelium of the urinary tract. So mostly what we have here, the labile cells are the hematopoietic cells and the epithelial cells of various types, that is the squamous cells, the cuboidal cells, the columnar cells, and the transitional cells. Now, the second category of cells, depending on their intrinsic ability to divide, are the stable tissues, or these stable cells are those which under normal conditions are not dividing. They are quiescent. They are in G0 stage of the cell cycle, but they have minimal proliferative activity. That is, they can be made to divide under special circumstances, like that of tissue injury. These are the cells which are like the endothelial cells, the fibroblasts, and the smooth muscle cells. So under normal conditions, they are not dividing. But if there is injury to these cells or they are required to replace, then they may be made to undergo this cell proliferation by pushing them into the cell cycle. The third type of tissue, or the third category, are the permanent cells or the permanent tissues. These are non-proliferating in the postnatal life. That is, after the birth of the baby, these do not multiply and these do not divide. These are the neurons and the cardiac muscle cells. Also, the skeletal muscle cells have been put in this category. So we can say that in the adult life, if there is injury to these cells, they are replaced by the scar tissue, connective tissue, since they are unable to divide themselves. As you can see in the example of myocardial cells, I've already told you, whenever there is myocardial ischemic injury, the replacement is by the scar tissue rather than the cardiac muscle cells. So recapitulating, what do we have? We have that labile tissues are those where division is taking place all the time. These are mostly the epithelial tissues, also the hematopoietic tissues, which are continually being lost and replaced. And if the demand increases, then the supply would also increase. Then a small amount of division may also take place in the stable tissues, like that of the kidney or liver. Liver is a unique example. We will be discussing it in a while. But for the time being, let's consider the kidney. If there is one kidney is removed, then we know that the other kidney undergoes compensatory hypertrophy and hyperplasia. So that is again under special circumstances, this kidney is tissue is being pushed into division. These kidney cells are being pushed into division, and they are being made able to divide. So these are under stable tissues, and this can only occur if the residual tissue is intact. If it is removed or damaged in entirety, then obviously no remnants are there, and which can give rise to this tissue. You would say that what is the driving force for this proliferation? Why or how, when there is injury, what makes these tissues undergo division or proliferation? So we know that there are growth factors which can divide or motivate these cells to divide. And these growth factors are proteins derived from various cells which are present in the neighborhood, like the macrophages and all. These growth factors, they act as ligands. They go and attach to the cells and activate signaling pathways. This signaling pathway then makes the cell undergo the cell cycle, and either it drives through the cells through the cell cycle, or it removes the blocks in the cell cycle. Here I would like to point out that there is also contribution of the extracellular matrix via the cell adhesion molecule, the integrins, to this process of proliferation. This diagram briefly tells you that suppose this is the growth factor which is acting as a ligand, and this is a receptor on the cell. So this growth factor binds to the receptor on the cell. It activates the signaling pathway or the second messenger system, which transduces the signal to the target, so that is the nucleus, the genes, where it may take place. It may result in a number of processes. In this case, it is altering the gene expression in such a way that the cells may be made to undergo the cell cycle once again. So this is how the growth factors may act. I have already told you that there is a little bit of contribution from the adult stem cells also, and they can also mature in the direction of the injured tissue. These adult tissue stem cells are cells which are present in small niches in the adults as well. For example, you can see that this is the hair follicle, and here nearby you can see a small epidermal stem cell present here, which, if there is injury, might be made to undergo a little bit of division and proliferation. Similarly, this is the crypt of a colonic gland, and here you can see that within the crypt there are a few stem cells near the base of the crypt, and these can again be made to divide if there is a requirement. So whenever there is an injury, the stem cells present in the niches, they proliferate first, and then they differentiate into the mature cells, which may supplement this repair process. I told you that liver is a unique organ or tissue in our body, which has a remarkable capacity to regenerate. Now, what is mostly these are stable cells where, as I told you, there is an overlap of tissue repair by scarring as well as regeneration. But in the liver, under certain circumstances, there is complete regeneration of the original tissue. But this can only occur if the framework or the connective tissue background is there, and also that there should be no inflammation present there. The liver, when it regenerates, it regenerates in three stages. The first is the priming of the liver cells. That priming means they are made ready to accept or react to the growth factors. And then the second stage is of growth factors, which leads to proliferation of the cells. And finally, the third stage is that these proliferating cells should be brought to a stop. And so the third step is the stage of termination. So we can see that when there is no inflammation of the liver and the liver tissue is removed, as in cases of partial resection for donor transplantation or for tissue for tumor removal. So when a part of the tissue is removed, part of the liver tissue is removed as such, without any inflammatory process being there, then we see that the rest of the cells undergo regeneration, and they can almost bring back the liver to the same state as it was, or the not exactly the same architecture, but the amount would the function might be restored, and although not exactly the same shape, but a lot of liver tissue would be regenerated. This diagram here shows you a liver lobule here, and if there is injury, it may take place, the repair may take place by two mechanisms. Here to the left, you can see that the connective tissue framework is still present here, and therefore when these liver cells proliferate, they migrate along these connective tissue framework or scaffold, and ultimately they recapitulate the normal architecture of the liver. This is regeneration. But if the connective tissue framework is lost, as may occur in the severe chronic inflammatory conditions, then although the cells are proliferating, but they will not be able to align themselves as in the normal, as with the normal architecture, and therefore the process would be such that the cell replacement would take place by connective tissue, and this would be called as scarring. Now I reiterate that the liver cells will proliferate and regenerate only if there is no damage by the inflammatory process or chronic inflammation, and so they proliferate in cases of partial hepatectomy, and this takes place by the action of cytokines and growth factors. The first phase, that is of priming, takes place by means of a cytokine known as interleukin 6, which is produced mainly by the Kupffer cells. This makes the cells ready to accept the effects of the growth factors. The second phase is that where the growth factors are released, that is the hepatocyte growth factor and the transforming growth factor alpha. These are released and they act upon the hepatocytes and make them divide. A secondary process which is taking place is the replication of non-parenchymal cells, that is the Kupffer cells, the endothelial cells, and the stellate cells. So this comprises the second phase, and that is of proliferation by means of growth factors. And then these dividing cells cannot just go on dividing. A stop has to be there. Now what is the termination process? The final phase, the termination phase, is where these hepatocytes are again brought back to their state of quiescence. And this occurs mostly by enzymes known as matrix metalloproteinases, MMPs. Here you can see this is priming by the interleukin 6 released from the Kupffer cells, and these, after being primed, they are acted upon by the transforming growth factor alpha and the hepatocyte growth factor, and these growth factors then cause them or put them into the cell cycle and make them divide and proliferate. So we can see that for regeneration, even in cases of liver, two things are important: proliferation of the remaining hepatocytes and also by the action of repopulation from the progenitor cells. What are the progenitor cells? The stem cells. Now we would go on. This was regarding regeneration, repair by regeneration. Now we move on to the second process of regeneration, repair, and that is tissue repair with connective tissue leading to scarring. As I told you, for regeneration, there were certain prerequisites. If these prerequisites are not met, that is, the tissues that are injured are unable to divide, or they are uninjured tissue is not present there, the fibrous tissue net framework is not present there, then what would happen? Then the repair would take place by the presence of connective tissue laying down, and that is known as scar formation. The various steps in the process of scar formation are the angiogenesis, that is new vessel formation, then the formation of the healing tissue, which is known as the granulation tissue, and finally the remodeling of the scar. We will take it up one by one. But first, let me show you that whenever there is injury to the tissue, first there occurs the inflammatory processes are there. Inflammation comes in. The inflammatory area is then replaced by the healing tissue, and finally there is remodeling of laying down of the scar tissue. So, what is angiogenesis? Angiogenesis implies new blood vessel formation from the already existing ones. And what about the fetus, where the new blood vessels are being formed from nothing? In that case, or from the cells which are not exactly blood vessels at that time, that process is known as vasculogenesis. So in the fetus, where there are no blood vessels yet and they are starting from the very beginning, that process is known as vasculogenesis. Whereas if the blood vessels are forming from the already existing ones, it is known as angiogenesis. During this angiogenesis process of angiogenesis, these new blood vessels are very delicate and they do not have a covering of parasites and basement membrane proper, and hence these vessels are very leaky. So one would find a lot of edema in the healing tissue even when the inflammatory edema is not there. Besides this, the vasoactive vascular endothelial growth factor causes vasodilatation and increases the permeability of these vessels and also makes the fluid come out, contributing to the perivascular edema. The process of angiogenesis implies or shows that initially it starts with stimulation by the vascular endothelial growth factor, which makes the one cell sprout out or form a leading tip, start to migrate towards the cell, towards the area of injury. So initially, one cell forms the leading tip, which would migrate to the area of injury. Then the cells behind that sprouting cell or the tip cell would proliferate the endothelial cells and form a tube-like structure. And finally, there will be remodeling of the capillary tubes. These are very delicate and fine tubes, and they have to be reinforced. The reinforcement takes place by the periendothelial cells and ultimately leads to the formation of mature cells. What are these periendothelial cells? These are pericytes in the capillary cells and smooth muscle cells in the slightly larger medium-sized arteries. This diagram here again shows the same process. First, let us see the cross section of the blood vessel here. These are the endothelial, this is the lumen here, the endothelial cells, the basement membrane, and the pericytes. Whenever there is angiogenesis, one of the cell is transformed by the vascular endothelial growth factor, and it becomes the sprouting cell or the tip of the leading tip cell. This leading tip cell then migrates towards the site of injury and forms a tube behind it. The cells, endothelial cells from the vessel, follow this tip cell and ultimately lead to the formation of this tube. They come together and a patent canal is formed, a patent blood vessel is formed. During this process, another feature is taking place, and that is the laying down of the basement membrane and recruitment of the pericytes in order to strengthen the blood vessel. This sprouting cell is made to elongate or move forward by the action of MMPs, the matrix metalloproteinases, which break up the basement membrane, and angiopoietin, which loosen up the pericytes, and hence they are able to migrate and move forward. Another thing that has its contribution here are the notch signaling pathway. What is the purpose of notch signals here? The notch pathway regulates the formation of these such that their distancing and is managed and they are not crowded together. The various in the signaling pathways of angiogenesis, a number of factors contribute. As I told you, the most important is the vascular endothelial growth factor, which initiates the process and makes the endothelial cell transform itself into the tip cell or the sprouting cell and move forward, and the other cells to follow it. Then there is the fibroblastic growth factor, which also acts on the endothelial cells. Besides this, it causes the migration of the macrophages and fibroblasts to this area. Angiopoietin 1 and 2, these cause the structural maturation of the new vessels, laying down of the collagen also, and basement membrane. And then these are the growth factors, platelet-derived growth factor and the transforming growth factor beta. These serve to stabilize the process. And the notch signaling, as I told you, it is very important in regulating the sprouting and the branches such that there is no crowding together of these vessels and they are moderately spaced out. Finally, there is a role of enzymes, the enzyme matrix metalloproteinases, which degrades the extracellular matrix to permit the remodeling and extension of the vascular tube. Now, within this tissue, this matrix metalloproteinases are usually produced as inactive zymogens, which are converted by other proteinases and into active enzymes, which can act during the process of angiogenesis. And finally, in order to stop them, there are inhibitors of matrix metalloproteinases which are present in the surrounding tissues, and these are known as tissue inhibitors of matrix metalloproteinases, TIMPs. So this was one of the processes of repair by connective tissue, that is angiogenesis. Now we would consider the formation of granulation tissue. What is granulation tissue? Granulation tissue is also referred to as the healing tissue. That is, it forms there for the purpose of healing. It is so called because of its gross or naked eye appearance being pink, soft, and slightly granular. It is composed of fibroblasts, which lay down connective tissue, which is this loose connective tissue, new blood vessels, sprouting blood vessels by the process of angiogenesis, and a few infiltrating leukocytes. because amongst the leukocytes there are macrophages, and macrophages are a source of a number of growth factors. So this is the appearance of granulation tissue, where you can see these new blood vessels. A number of new blood vessels are there. This is the loose connective tissue background in which these are present. A few inflammatory cells here and there. So basically, this is the pink granular tissue, which is known as the granulation tissue or the healing tissue. This tissue, with time, it matures. What is meant by maturing? Maturing means that the number of the sprouting blood vessels decreases, and more of collagen is laid down in the loose connective tissue, within the loose connective tissue. So if you consider the picture on the right, you can see that the number of blood vessels is much less than within the granulation tissue, and also the intervening area shows a very dense collagen deposition. This is not the normal H&E staining. This is a special stain, the trichrome stain, which stains the collagen as blue. So here you can see the blue, all the blue area is the dense collagen. And you can see this is known as maturation of the granulation tissue to scar formation. This is the very delicate, granular, soft fibrovascular tissue, which is known as granulation tissue or the healing tissue. With time, it matures into the scar tissue with a lot of collagen laying down, lot of connective tissue laying down, and then occasional blood vessels being present here and there. This deposition of connective tissue takes place in 2 steps. First is the migration and proliferation of fibroblasts into the tissue injury. And secondly, there is deposition of extracellular matrix proteins produced by these cells. This is the process of maturation that I was talking about. And these growth factors and cytokines which promote all this are derived from the M2 macrophages. You know what M2 macrophages are? The ones which are formed through the alternate process of activation. If you don't recall, then please go back and read it. There are 2 processes, M1 are activated by the classical and M2 by the alternate pathway. Alright, so the various growth factors which come into play here are the platelet-derived growth factors, fibroblastic growth factors, and the transforming growth factor beta. The transforming growth factor beta is a very important cytokine for the process of synthesis and deposition of connective tissue. Okay, in the process of maturation, the granulation tissue is now converted into the scar tissue, where the fibroblasts are now very much spindly in shape and have secretory functions, that is, they deposit collagen or they produce collagen, which is deposited and this dense deposition of collagen is there. A few fragments of elastic tissue might also be encountered, and other extracellular matrix component might also be present there. But mostly it is the dense collagen and spindle-shaped mature fibroblasts which are present in the scar tissue. Some of the fibroblasts transform into a special type of cells known as the myofibroblasts. Now, what are these myofibroblasts? These are, you can say, a combination of fibroblasts with the properties of the smooth muscle cells. These are come in very handy in the ultimate contraction of the connective tissue, because all the fibrous tissue that has been laid down, ultimately it is remodeled and it undergoes contraction. The contraction of the laid down fibrous tissue takes place by means of these myofibroblasts. When the collagen is being laid down, this has to be, that there is process there every process in the universe, there has to be balance in every process in the universe. So there has to be balance in the synthesis and the degradation of the extracellular proteins which are being laid down in the connective tissue scar formation. And the process of laying down, we have seen, is by means of various growth factors. What about their termination? Or how would this process end? Otherwise, it would go on laying down more and more extracellular matrix proteins and collagen. So, this takes place by a family of enzymes known as matrix metalloproteinases. These matrix metalloproteinases are produced by fibroblasts, macrophages, neutrophils, etc., which are present in the surrounding areas. Alright, now I hope that you have understood the various processes. Let me just recapitulate by saying that the terms healing and repair may be used interchangeably. The repair or tissue repair takes place by two major processes. One is regeneration, where the structure and the function are almost completely restored, whereas in the other process, which is tissue repair by scar formation, there a stable scar or a patch has been provided, but the entire the function and the structure is not replaced in entirety, but rather just a stable scar or a stable patch has been provided, which is quite manageable and quite functional. So we can say that not all injuries result in a permanent damage. Some are resolved almost completely. This is regeneration. More often, there is some degree of scarring, and the scar is usually good, but occasionally, in certain conditions, it may be a source of permanent dysfunction. For example, in a large myocardial infarct, if there is a large scar, it may pose or it may cause certain complications. But mostly, it is a good thing because it is patching up the damaged area and providing some sort of functional support and structural support. Finally, let us just compare the processes of regeneration and repair by scarring. For regeneration, there should be restoration of the normal tissue architecture, which requires that the connective tissue framework should be present and the dividing cells should be present. The dividing cells may be the labile cells or sometimes the stable cells. And the repair by scarring, the normal tissues are not replaced. Rather, there is a patch provided by the scar tissue. For this, this usually takes place when the prerequisites for regeneration, that is the dividing tissues, the framework, presence of a connective tissue framework, are absent. And that is when the tissues do not divide. You remember that they are called as the permanent tissues. So this repair by scarring takes place when there is injury to the permanent tissues and there is no extracellular matrix. And this involves a lot of deposition of extracellular matrix proteins, that is the collagen, and ultimately leading to scar formation. I hope you are clear about the basics of tissue repair, because in my next lecture I am going to take up an example of tissue repair that is a very good example which will demonstrate all these features that we have discussed today, that is of cutaneous wound healing. And then we will discuss the various factors which can affect the repair process or wound healing and the various complications that may occur. If there are any questions, you please feel free to ask them. You can contact me on the chat system here. With this, thank you very much.